Today I'll show you how muscle weakness develops and how you can intentionally make it happen. How to make a muscle stop working. I'll show you using this cervical plexus and a few muscles in the arm as an example. As I've often said, when a nerve is compressed, meaning when it's pinched by certain structures, weakness develops in specific muscles, and later on pain appears. And today we'll simulate exactly that. We'll intentionally compress a certain nerve and make it so that some muscles stop working and become inactive. And you'll see how quickly this happens, meaning it's enough for the nerve to be compressed for just a short time. And you'll see that this is enough for a certain muscle to stop working. This happens because the neuromuscular transmission is disrupted, meaning the muscle itself remains fine and nothing happens to it. But because the nerve is compressed, the impulse from the spinal cord, from the brain through the spinal cord, simply doesn't reach the muscle and it can't contract. That's why when doing exercises in the gym or therapeutic exercises, it's very important to first eliminate all nerve compression problems and identify them, because if you're doing exercises and your muscle can't activate because the nerve that innervates the muscle, the one that sends the impulse for it to contract, is compressed somewhere, then with your training you'll only cause even more injury and nothing else. If you're working out in the gym and notice that some muscle is lagging behind, that's already a reason to think about whether you might have this kind of issue. I'll show you a few cases where muscle can become weak. The first is what I already mentioned, nerve compression. And the second is instability at the attachment points, when the places where the muscle attaches change their position. The clavicle, rib, and scapula should be in a certain position, but sometimes they shift out of place. As a result, the muscle loses its ability to contract normally. And the next, third option, where the muscles stop working, is the body's position itself. That is, in certain body positions, the muscles simply can't activate. For example, let's demonstrate using different volumes of back extensors and different volumes of gluteal muscles. But the same thing can happen with any other muscles as well. But for example, the arch of the foot. On one side, the arch of the foot might be flatter in a person than on the other side. And because of this, he starts to lean to one side, to the side with the flatter arch of the foot. So he develops this asymmetry. And on the side where the arch of the foot is flattened, he will develop weakness in many muscles. It's pointless to do anything with them, train or treat them, until this problem is resolved. The three reasons are the nerve attachment points and body position. Today we'll show how all of this affects muscle tone. Now, Using the deltoid muscle as an example, I'll show how you can turn it off, make it stop working. We're testing the deltoid muscle. It's working, meaning it can withstand force quite well. The first way to make it stop working is to disrupt the nerve conduction. Now, we compress this group of nerves at the point where the nerve exits, which will innervate the deltoid muscle. It stops working. There's practically no strength. I cause a disruption of the nerve impulse conduction simply by compressing the nerve at the exit point. The same thing will happen not only in the deltoid muscle. This hand is not visible. The same thing. It doesn't work because it's not visible in the frame. Here, the same thing can be with the triceps. Down. With the biceps. Finger flexor. Hold it, not too much. Biceps. Up, high, high. Also cause nerve compression. Up, up. There's no effort in the biceps now. Down, 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 down. The same thing in the triceps. Down, it completely stops working. It takes some time for the nerve conduction to recover. For a while, down, it still won't work. For about half a minute or so, the muscles won't activate. It takes some time for it to start working again. So that's the first one. The main cause of muscle weakness is its nerve compression of the nerve. Right now, we specifically triggered it at the point where the nerve exits. You can do this with any nerve, but during certain illnesses, it happens automatically. The nerve gets compressed between some muscles. When that happens, the nerve is compressed and the muscles stop working. But there won't be any pain at first, meaning you don't feel pain right away. First, muscle weakness appears, but there's no pain immediately. The pain will appear after some time in the joints that cause movement, in the joints where the muscles are turned off, the muscles that take over their function during movement will hurt, because when the deltoid doesn't work, the trapezius will work instead of it. Also, often here the deltoid muscle started working again. Another common reason why muscles don't work is instability at the attachment points. Here is the deltoid muscle. It has several attachment points: the clavicle, the scapula, the acromioclavicular joint. This is the middle deltoid. How can we make it stop working? I take this acromioclavicular joint and simply separate it like this. I make this place where the clavicle and scapula connect unstable. I deliberately stretch the ligament and the deltoid muscle stops working. Look, with just 2 fingers, there's no effort at all. Is there pain or no pain? Pain can appear in the joint. To fix this again, you need to connect this joint and contract the rear deltoid several times, back and forth, back and forth, back and forth, and contract them upward. Contract them several times so it starts working again. This, for example, is how you turn off the rear deltoid. You can do the same thing with any other muscle. You make the attachment point unstable, because a muscle has a certain length and its attachment points always need to be at a certain length. If they become shorter or longer, the muscle can contract. In addition to nerve compression and instability of attachment points, which can cause weakness in a muscle, another common reason is incorrect body posture. When a person is sitting or standing, Basically, that's how it happens. For example, this is important for athletes as well. So an athlete who does the bench press, for instance, in this exercise, the pectoralis major muscle is involved, and it should generate maximum effort. Let's do a test for the pectoralis major muscle. Push inward, don't bend your arms. Push inward, push one more time. There, it is working. The pectoralis major muscle. There are cases when a person has scoliosis, for example, on their paravertebral muscles or latissimus dorsi muscles are unevenly developed along both sides of the spine. Sit there facing forward. These are the muscles that are located right here along the spine. It often happens that one muscle is bigger than the other, and when a person lies on their back, they end up lying on an uneven surface, tilting slightly to one side. Now we'll simulate what it would be like if the muscle on the right side is bigger than on the left side. Lie on your back again, this time instead of the muscle. Okay? We'll put a muscle substitute underneath, just a small one, about 1/2 centimeter. Press inward again, and at the same time, see, I can do this with 2 fingers. Press harder. Immediately muscle weakness appears on both sides because he's just lying there crooked like this. That's why athletes who have unevenly, see, we removed it and the muscles work again. For athletes whose muscles are unevenly developed, this prevents them from achieving maximum results. For example, in the bench press, right? Now sit up. And if he's working out in the gym, okay, let's do it like this. Can you turn around? For example, if he's working out in the gym and his gluteal muscles are different in size. See, his gluteal muscles are different in size. The left one is smaller. No, just a bit like this here. So because his left gluteal muscle is smaller, he keeps leaning to this side. It really is smaller, this much. Here's the right gluteal and here's the left gluteal. And every time he sits, Ibudu or Trabot. The muscles on this side of his chest and shoulder joint won't work properly because he sits on different glutes. The function of the joint and the muscles of the shoulder joint will be disrupted. Chest movement will be restricted on this side. I inhale and exhale, inhale and exhale. Now pay attention to the movement of the chest here on this side, on the right. Inhale again, there is movement, but on this side there is no movement. The range of motion in the neck, look, he tilts it to one side, see. Here the hand almost stays in place, right? When he tilts it to this side, the range of motion is much greater in this direction than in the other. This is what we call a limitation of movement. It's the same with turning. In this direction there is a limitation of movement, but in the other direction he turns much better. We can test the muscles. Here's the deltoid on this side and the deltoid on this side. This one also works worse for him. And not just the deltoids, we can test any muscle. The front deltoid won't work either. The pectoralis major won't work either. Nothing will work. Even the neck extensor, yes, it all shuts down. And everything will hurt for him, but only while sitting. The only thing that will help him is this. Increase the gluteus or decrease the other one on the right side, or always keep something in the right pocket. Put something in your left pocket to compensate for the lack of volume in your gluteal muscle, about 1/2 centimeter. So We put something under that gluteal muscle, and immediately his shoulders become level. Take a breath. The chest starts to breathe symmetrically. The muscles start working for him. Well, any muscle on this side, back, and the range of motion already becomes symmetrical. To this side and to this side, the turn as well. There you go. But as soon as we remove this thing, he's sitting on different gluteal muscles again. He leans to this side again, and all the same issues come back for him. And if he does exercises in this position, for example, he goes for treatment, and they give him some set of exercises, recommend, for instance, to bring his shoulder blades together. And every time he does this while sitting, he'll be causing himself even more injury. It'll stay this way until his glute muscle grows. Otherwise, things are going to keep looking bad.